Have you ever looked at a small symptom on your body? Something minor like dry skin, cracked lips, or muscle cramps, and wondered if your body might actually be trying to tell you something important? What if many of the everyday problems people ignore are actually early warning signs of nutrient deficiencies? Not dramatic diseases, not emergencies, just quiet signals that your body is missing something it needs. And the fascinating part is that once you learn how to read these signals, your body begins to make a lot more sense. Today we're going to walk through 23 different signs your body may be lacking key nutrients. But before we dive into the list, we need to talk about something even more important. Why do people become deficient in the first place? Because if you understand the causes, fixing the problem becomes much easier. Most deficiencies come from three major sources. The first is poor absorption. Even if you're eating good food, your digestive system might not be absorbing the nutrients properly. Damage to the gut lining, low stomach acid, or problems with bile production can prevent nutrients from entering the bloodstream. For example, if someone has gallbladder problems or poor bile flow, they may struggle to absorb fat-soluble vitamins like vitamin A, vitamin D, vitamin E, and vitamin K. The second cause is nutrient-poor food. Modern farming often prioritizes size, shelf life, and appearance over nutrient density. Many fruits and vegetables look beautiful on the outside, but contain far fewer nutrients than foods grown in mineral-rich soil decades ago. And the third cause is refined foods and sugar. Highly processed carbohydrates can actually drain nutrients from the body. They require vitamins and minerals to be metabolized, meaning the more refined sugar someone eats, the more nutrients their body burns through. Now that we understand why deficiencies happen, let's start looking at the signals. Sign number 1. White spots on the nails. Have you ever noticed small white dots or specks on your fingernails? Most people assume they come from bumping the nail or from some type of minor injury. And while trauma can sometimes cause discoloration, recurring white spots often tell a different story. They can be an early sign of a zinc deficiency. Zinc is one of the most important trace minerals in the human body. It supports immune defense, hormone balance, wound healing, and healthy skin growth. Your nails are constantly regenerating tissue, and when zinc levels drop, the nail structure can begin to show small irregularities like these white specks. What's fascinating is that the nail actually works like a timeline. Since nails grow slowly, those white spots often reflect something that happened weeks or even months earlier in your diet. One of the fastest ways zinc becomes depleted is through excess sugar consumption. When the body processes high amounts of refined carbohydrates, it uses up important minerals, including zinc. Over time, repeated sugar intake can slowly drain the body's zinc reserves. So if you notice these white spots appearing frequently, it may be your body quietly telling you two things: reduce refined carbohydrates and increase foods rich in zinc, such as beef, shellfish, pumpkin seeds, and eggs. Sign number 2. Oily skin. Oily skin may seem like just a cosmetic issue, but in many cases, it reflects deeper hormonal imbalances happening inside the body. The skin contains sebaceous glands that produce an oily substance called sebum. This oil is important because it protects and moisturizes the skin. But when these glands become overactive, the skin can appear excessively shiny or greasy. One key factor that influences these glands is androgen hormones. When androgen levels become elevated or unbalanced, sebum production increases dramatically. Zinc plays an important role in regulating these hormones and helping maintain balance. When zinc levels drop, the body can lose some of its ability to regulate androgen activity. The result is overactive oil glands and sometimes acne or clogged pores. High sugar diets can make this problem worse because excess insulin can increase androgen production while simultaneously depleting zinc. Improving zinc intake and reducing refined carbohydrates often leads to noticeable improvements in skin oil production. Sign number 3. Cracks at the corners of the mouth. Small painful cracks at the corners of the mouth are surprisingly common. This condition is often linked to deficiencies in B vitamins, especially vitamin B2 and B3. These vitamins are essential for maintaining healthy skin tissue and supporting the body's ability to repair itself. They also play a major role in energy production within cells. When the body runs low on these nutrients, delicate tissues such as those around the mouth may begin to break down or develop small fissures. One of the most common causes of B vitamin deficiencies is a diet high in refined grains. When grains are processed into white flour, most of their natural B vitamins are removed. Restoring these nutrients through whole foods like eggs, meat, organ meats, and nutritional yeast can help the body repair these tissues and restore skin integrity. Sign number 4. Flaky skin around the nose or forehead. If you notice persistent dry or flaky skin around the nose, eyebrows, or forehead, it may reflect an imbalance in essential fatty acids. Your body relies on two main types of essential fats, omega-3 and omega-6 fatty acids. Both are necessary, but the ratio between them matters greatly. Modern diets often contain excessive omega-6 oils from processed foods, vegetable oils, and restaurant meals. When omega-6 intake becomes too high and omega-3 intake too low, inflammation can develop in the skin. This imbalance often shows up as redness, dryness, or flaking around areas with high oil gland activity. Increasing omega-3 sources such as fatty fish, sardines, and cod liver oil while reducing highly processed vegetable oils can gradually restore balance. Sign number 5. Yellowing of the eyes. When the whites of the eyes begin to develop a yellow tint, it often indicates a problem involving the liver or bile flow. The liver plays a critical role in filtering waste products from the bloodstream. One of these waste products comes from the breakdown of red blood cells. Normally, the liver processes these compounds and sends them out of the body through bile. But when bile flow slows down or becomes blocked, these pigments can build up in the bloodstream. As they accumulate, they begin to tint the skin and the whites of the eyes yellow. This can signal that the liver or gallbladder is struggling to process and remove waste efficiently. Supporting healthy liver function, bile flow, and digestion can often help restore normal balance. Sign number 6. Chronic cough. A cough that lingers for weeks without infection or illness can sometimes be connected to mineral imbalances. Calcium plays an important role in nerve signaling and muscle contraction. It helps regulate how muscles tighten and relax throughout the body. When calcium levels drop too low, muscles in the throat and respiratory system can become overly sensitive or prone to spasms. This irritation can sometimes trigger a persistent dry cough. Restoring proper mineral balance may help calm these muscular responses. Sign number 7. Bleeding gums. Bleeding or swollen gums are one of the most classic signs of vitamin C deficiency. Vitamin C is essential for producing collagen, the protein that forms the structural foundation of connective tissues. This includes the tissues that support the gums and teeth. Without enough vitamin C, these tissues weaken. Small blood vessels become fragile and may begin to bleed during brushing or flossing. Vitamin C also strengthens the immune system and helps control inflammation in the mouth. Increasing vitamin C-rich foods such as bell peppers, leafy greens, citrus fruits, and fermented vegetables can often restore gum health quickly. Sign number 8. Poor night vision. Difficulty seeing in dim lighting or struggling to adjust your eyes in the dark may point toward vitamin A deficiency. Vitamin A plays a critical role in the retina, the light-sensitive tissue at the back of the eye. It helps create the pigments necessary for detecting light in low-visibility conditions. Without enough vitamin A, the eye has trouble adapting to darkness. The most effective form of vitamin A is retinol, which is found primarily in animal-based foods, such as egg yolks, liver, butter, and fatty fish. Sign number 9. Chapped lips. Persistent dry or cracked lips may indicate B vitamin deficiencies, especially B2. These vitamins support healthy skin turnover and tissue repair. When levels drop, The lips often become dry, irritated, or cracked despite the use of lip balm. Correcting the nutritional deficiency usually resolves the problem far more effectively than topical treatments. Sign number 10. Swollen ankles. Swelling in the ankles that leaves a small indentation when pressed is known as pitting edema. This condition can sometimes reflect low potassium levels. Potassium plays a crucial role in maintaining proper fluid balance within the body. It helps regulate sodium levels and ensures fluids move properly through tissues. When potassium becomes too low relative to sodium, fluid may accumulate in the lower extremities. Increasing potassium-rich foods like leafy greens, avocados, and vegetables can help restore electrolyte balance. Sign number 11. Craving ice. An unusual craving for ice, known medically as pagophagia, is frequently linked to iron deficiency anemia. Iron is essential for transporting oxygen in the blood through hemoglobin. When iron levels fall too low, oxygen delivery throughout the body becomes less efficient. In response, the body may develop unusual cravings or behavioral signals that reflect the underlying deficiency. Sign number 12. Chest discomfort. During activity. Chest tightness or discomfort during exertion may sometimes be associated with vitamin E deficiency. Vitamin E acts as a powerful antioxidant that protects the lining of blood vessels from oxidative stress. Healthy blood vessels require adequate vitamin E to maintain flexibility and smooth blood flow. Sign number 13. Leg cramps. Painful calf cramps, especially at night, are among the most common signs of magnesium deficiency. Magnesium is essential for muscle relaxation, nerve signaling, and hundreds of enzymatic reactions in the body. When magnesium levels drop, muscles may contract involuntarily, leading to sudden spasms or cramps. Sign number 14. Irritability and anxiety. Feelings of tension, irritability, or persistent nervousness may sometimes reflect low vitamin B1 levels. Vitamin B1 supports energy production in nerve cells and helps regulate signals throughout the nervous system. When levels fall too low, the brain may struggle to maintain stable nerve communication. Sign number 15. Asthma or breathing issues. Vitamin D deficiency is strongly associated with respiratory inflammation. Vitamin D helps regulate immune responses and reduce inflammatory activity within the lungs. When levels are restored through sunlight exposure or supplementation, breathing symptoms often improve. Sign number 16. Loss of outer eyebrows. Thinning of the outer edges of the eyebrows may indicate thyroid imbalance or iodine deficiency. Iodine is a key component required to produce thyroid hormones, which regulate metabolism and energy throughout the body. Sign number 17. Tightness in the right shoulder area. Pain or tightness in the right shoulder or upper back can sometimes be referred pain from the gallbladder. Poor bile flow or gallbladder stress may create pressure that radiates through nerves into the shoulder region. Sign number 18. Frequent nightmares. Vitamin B1 deficiencies can influence areas of the brain involved in emotional processing and stress regulation. When B1 levels are low, sleep patterns and dream intensity may become disrupted. Sign number 19. Craving salty snacks. Strong cravings for salty foods may reflect sodium imbalance, particularly in people who sweat heavily or exercise frequently. Maintaining proper electrolyte balance between sodium and potassium is essential for nerve signaling and fluid balance. Sign number 20. Persistent low back pain. Chronic stiffness, or pain in the lower back, can sometimes be linked to vitamin D deficiency. Vitamin D helps regulate inflammation and supports healthy bones and muscles. Sign number 21. Craving dirt. A rare condition called pica involves cravings for non-food substances like dirt or clay. This behavior is frequently associated with severe iron deficiency. Sign number 22. Erectile dysfunction. Low testosterone levels and erectile dysfunction can sometimes be linked to zinc deficiency. Zinc plays a crucial role in testosterone production and reproductive health. Sign number 23. Depression. Low mood and persistent depression are often associated with vitamin D deficiency. Vitamin D influences serotonin production, a neurotransmitter that plays a key role in regulating mood and emotional stability. The bigger lesson. What's fascinating about these symptoms is that they show how interconnected the body really is. A small nutrient imbalance can create signals in the skin, muscles, nervous system, and even mood. But when the missing nutrient is restored, many of those symptoms improve surprisingly quickly. Your body constantly communicates with you. The key is learning how to listen. And once you start recognizing these signals, you can begin addressing problems early, long before they turn into more serious health conditions. With that said, thanks for watching, and until next time.